Defining the pathway to timely diagnosis and treatment of interstitial lung disease. A US Delphi survey. Early diagnosis of patients with interstitial lung disease, or ILD, is important for delaying disease progression and prolonging survival. However, the patient pathway to an accurate ILD diagnosis and appropriate management is not always straightforward. The aim of this study was to seek consensus on the key steps of the patient journey that facilitate a timely and accurate ILD diagnosis and appropriate management in the U.S. We conducted a 3-round modified Delphi survey to assess consensus. It involved a series of questionnaires that are reformulated based on responses at each round. The surveys were completed by 43 pulmonologists and 6 primary care physicians from the U.S., all with extensive experience in managing patients with ILD. Overall, we reached robust consensus on 95.4% of the statements, helping to define a clear pathway to early ILD diagnosis and management. The panel agreed on the key actions of a primary care physician. For example, a primary care physician should order an HRCT scan for patients with suspected ILD if they are familiar with the correct imaging technique to request and can ensure adequate quality. There was also consensus on the role of a radiologist, including agreement on use of a standardized template for HRCT, and the most important elements to include. For the pulmonology evaluation of a patient with suspected ILD, the panel agreed on 14 statements, including what should be included in the patient workup, which serologies are most important to order, when to order an HRCT scan. The panel also agreed on how a pulmonologist should manage patients with a diagnosis of ILD. For example, follow up with patients every 3 to 6 months, depending on the diagnosis and disease severity. Finally, the panel reached consensus on the process for patient referral to an ILD specialist center, with agreement on referral considerations. Which patients with IPF should receive early referral, and what to include in the referral package. In conclusion, these results help to define the key considerations that facilitate the patient pathway to diagnosis and management of ILD.